currently eligible for license under the Medical Cannabis Program. Also, during this hearing, the Medical Cannabis Advisory Board will hear information and issue recommendations concerning rules and quantities of cannabis that are necessary to constitute an adequate supply. Pursuant to notice, this matter is being heard this 9th day of December 2020 via a WebEx events platform and is being recorded. The time is 9:03. I am Stephanie Richmond, and I am the newly elected chairperson for the Medical Cannabis Advisory Board. New Mexico Department of Health Assistant General Counsel Chris Woodward will be advising the department during this proceeding. This proceeding is being held in accordance with the Linen Aaron Compassionate Use Act, Sections 26-2B-1 through 26-2B-7 NMSA 1978, and regulations at NMAC Title 7, Chapter 34, Part 2. If members of the audience have not already registered for the event, please register online so that your attendance may be noted and included with the Advisory Board's submission to the Secretary of Health. To start, I would like to have an introduction of board members and take a roll call. Ariel Bowers.
Hi, my name is Ariel Bowers. I am a certified nurse midwife and a psychiatric nurse practitioner working out of Albuquerque.
Thank you. Kenneth Carraza. John Paul Dedan.
There we go. Okay, sorry, I had to unmute myself. Good morning, everyone. Thank you for joining us. I am Jean-Paul Dedam. I am a family medicine doctor by training. I also am board certified in medical acupuncture, and I run a symptoms management clinic for New Mexico Cancer Center, working with cannabis and cancer and rheumatology patients.
Thank you. Rachel Goodman. Courtney Marquez.
Good morning, I'm Courtney Marquez, and I'm a physician assistant at the New Mexico Cancer Center, and I work with oncology, hematology, and rheumatology patients.
Thank you. Alan Limal. Davin Quinn.
Good morning, my name's Davin Quinn. I'm a psychiatrist at the University of New Mexico. Thank you.
Thank you. My name is Stephanie Richmond. I'm a physician assistant and a primary care provider at the University of New Mexico in an outpatient clinic. I understand that Kenneth Carraza has also joined. Would you please introduce yourself?
Yes, Ken Carraza. I'm a clinical pharmacist, the Medicine Chest in Albuquerque, New Mexico.
Thank you. Tracy White.
Good morning. I'm Tracy White. I'm an assistant professor at the UNM College of Pharmacy and a pharmacist clinician at the Memorial Medical Center Cancer Center in Las Cruces, as well as part of the palliative care team, both on the inpatient and outpatient side.
Thank you. At this time, we have 8 of 9 advisory board members present and therefore have established quorum. I also understand that we have members from the Medical Cannabis Program present and would also like you to introduce yourself and give your title as well, please. for the record.
Good morning. My name is Dr. Dominic Zerlo, and I am the Director for the Medical Cannabis Program Division with the New Mexico Department of Health.
Good morning. My name is Chris Woodward. I'm the Acting General Counsel for the New Mexico Department of Health.
Hello, this is Dr. Gary French. I'm the Medical Director for the Medical Cannabis Program.
Hello, my name is Martinique Gonzalez, and I am the License and Compliance Program Manager for the Medical Cannabis Program.
Good morning, Andrea Sundberg, Health Program Manager of Medical Cannabis Program.
Hi, this is Elizabeth Jensen. I am the health educator with the New Mexico Medical Cannabis Program.
Thank you, everyone, and welcome. We will now proceed with the hearing agenda. And first item is for a medical cannabis program update. Would someone from the medical cannabis program like to provide us with an update?
Thank you, Dr. Richmond. So this is Dr. Dominic Zerlo, and essentially what I just wanted to do, because we just had the last Medical Advisory Board meeting last month, there aren't very many additional updates. What I would like to just point out are a few points from that previous update. So with our patient statistics, we now have, as of the end of November 2020, 101,770 patients enrolled in the program. Last month, we were just over 100,000 patients. So while that has not grown very much in this past month, looking at the same time period last year, between October and November, it actually only increased a similar amount by just over 1,000 individuals last year as well. So this is in keeping with the normal pace and pattern for patient enrollment within the program over the last couple of years. With regard to supply, we do not yet have the fourth quarter because that won't end until December 31st. So just as a reminder, for the quarter that ended on September 30th, with regard to our supply of cannabis in New Mexico, that the number of plants which were licensed to grow was at 51,250. The number of mature plants which were in production at that time was 30,264. The number of plants harvested during the quarter were 21,279. This again was a 40% increase over the third quarter in 2019, when approximately 15,000 plants were harvested. So with this, as far as for licensing, the licensed nonprofit producers can actually still grow an additional 21,000 more plants than were in production at the end of September. With this potential to be realized, the licensed nonprofit producers have reported, as of the end of the third quarter, total of 5,774,625 grams of flower and bud in stock, with an additional 3,617,266 units of cannabis-derived products. And just to give you a comparison, at the end of the third quarter in 2019, there were just under 4 million grams of flower and bud in stock, and we did not at that time track the cannabis-derived products. And so the amount of medical cannabis in stock at the end of the third quarter this year represents a 48.5% increase over the same time period of last year, just with regard to the flower and bud. And again, since state offices have been closed and continue to be closed since the implementation of the public health orders due to the COVID-19 pandemic. Because the program is trying to serve patients as best as possible, we continue to process applications and have continued to meet the statutory guidelines of approving or denying completed applications within 30 days and mailing their card within the additional 5 days. In addition, the License and Compliance section has continued to work through the pandemic to ensure that programs or that licensees are relicensed, amendments are reviewed, and that they are conducting site visits, usually by virtual means, although when it is safe and appropriate to do so, they are conducting those in person as well. In addition, as I had reported last month, the program and the department has been working with BioTrack to implement the patient portal where patients and providers will be able to submit applications online. While that has been delayed due to the impact of COVID-19, we do anticipate that to be available for both patients and providers very soon. And again, I would like to express my thanks to the board members for serving on this board, for helping with regard to the medical cannabis program. And I'd also like to thank the patients and the community members who are participating today. And I hope that everybody is able to remain as safe as possible during the current pandemic. Thank you.
Thank you. At this time, before proceeding with further business, I would like to revisit the vote tallies from the previous meeting in order to establish a more clear record and to provide a summary of those items adopted by the advisory board. I ask that each board member vote in favor aye of each item or in opposition no when called upon to vote. The first item of business from the last meeting was the election of a new chairperson for the Medical Cannabis Advisory Board. After a self-nomination by Stephanie Richmond was made, a motion to second my nomination for the Medical Cannabis Advisory Board chair was provided by Ariel Bowers with no one in opposition. I'd like to take a roll call vote by answering aye or no at this time in order to establish a clear record. Excuse me. Ariel Bowers.
Aye.
Kenneth Carrazza. John Paul Dedam.
Aye.
I'm sorry, I was muted. Ken Carrazza, aye.
Thank you. Is Rachel Goodman present? Okay, Courtney Marquez.
Aye.
Is Alan Plymel present? Davin Quinn.
Aye.
Stephanie Richmond, aye. Tracy White.
Aye.
The second item of business from the last meeting was the election of an alternate chairperson. After a self-nomination was made by John Paul Dedam, for the role of alternate chairperson, I seconded the motion to nominate him with no one in opposition. Let us take a roll call vote answering aye or no at this time to establish a clear record. Ariel Bowers.
Aye.
Kenneth Carrazza.
Aye.
John Paul Dedam.
Aye.
Rachel Goodman. Courtney Marquez.
Aye.
Alan Plymel. Davin Quinn.
Aye.
Stephanie Richmond, aye. Tracy White.
Aye.
Next item of business was to address the proposed rule change as it pertains to the issue of reciprocity. After much deliberation with regards to the amount of medical cannabis reciprocal patients would have access, the determination was made to continue discussion of this item later in the meeting once the petitions dealing with adequate supply and purchase limits had been discussed. Running short on time, this agenda item was tabled without opposition. Let us take a roll call vote answering aye or no at this time to establish that this item was tabled at the last meeting. Ariel Bowers,
Aye.
Kenneth Carrazza,
Aye.
John Paul Dedam,
Aye.
Courtney Marquez,
Aye.
Evan Quinn,
Aye.
Stephanie Richmond, aye. Tracy White.
Aye.
The next item of business discussed was the petition 2019-008, which sought to add ADHD, ADD, anxiety disorder, and Tourette syndrome to the list of qualifying medical conditions eligible under the Medical Cannabis Program. A motion was made to modify the petition for adults only. This modification was seconded, and the petition to add ADHD, ADD, anxiety disorder, and Tourette syndrome with the modification for adults only to the list of qualifying conditions was put before the board for a vote. The result was 9 ayes and 0 no votes. The next business item discussed was petition 2019-009, which sought to add substance use disorder to the list of qualifying medical conditions eligible under the Medical Cannabis Program. A motion was made to modify the petition and limit the use of medical cannabis for the following 3 substance use disorders only: tobacco use disorder, stimulant use disorder, and hallucinogen use disorder. This modification was seconded, and the petition with a modification to add tobacco use disorder, stimulant use disorder, and hallucinogen use disorder to the list of qualifying conditions was put before the board for a vote, and the result was 9 ayes and 0 no votes. The next petition discussed was petition 2019-10, which sought to add the use of medical cannabis to treat seizures in animals. The motion was made to table the petition until further information from the veterinary board was obtained. This motion was seconded, and the result was 9 ayes and 0 no votes to table this item. The next petition discussed was petition 2020-002, which sought to raise patient purchase limits to 15 ounces over a 90-day period. The motion was made to approve this petition, and that motion was seconded. The petition was approved by a vote of 8 ayes and 1 no vote. The next petition discussed was petition 2020-001, which sought to alter the current regulations that limit plant count. A motion was made to table this petition until the next meeting, and the motion was seconded. The result was 9 ayes and 0 no votes to table this petition until the next meeting. I will now make a motion to approve these minutes from the previous meeting. Do I have a second?
Second. This is Davin.
Davin has seconded the motion. We will now vote on the approval of minutes with aye or no. Ariel Bowers.
Aye.
Kenneth Carrazza.
Aye.
John Paul Dedam.
Aye.
Courtney Marquez.
Aye.
Davin Quinn.
Aye.
Stephanie Richmond, aye. Tracy White.
Aye.
All right. Thank you. We have now voted to approve the minutes from our last meeting by majority vote. And the next agenda item is to review the proposed rule changes. Does someone from the Medical Cannabis Program wish to speak regards to any proposed rule changes?
Thank you, Madam Chair. This is Dr. Zerlo again. And again, during the last meeting, I had actually read some information with regard to the summary of the rule. Instead of reading all of it, I will just provide some highlights on it. And then if there are questions, I am more than happy to answer those. So the main reason behind this rule change is to ensure that residents in the state of New Mexico are seeking the medical attention that's required to be enrolled in the program while under the medical care of providers in New Mexico. The proposed rules help to ensure that this is occurring and help to improve the health outcomes of New Mexicans enrolled in the program. This is important so that medical providers can ensure that patients are not experiencing negative outcomes or the potential masking of more serious medical situations by temporary relief of symptoms by the use of medical cannabis. Just like any other medication, we want to ensure that medical cannabis is being utilized under the care and supervision with a medical provider, and that there is a relationship between that provider and patient to ensure that there are not other issues or concerns, medical concerns, that are not being addressed. So this is being proposed and summarized in the Summary of Medical Cannabis Program Rule Amendments to 7.34.38, which is also a document that is located on the New Mexico Department of Health website under the Rules and Regulations, on the Rules and Regulations publication page. So the proposed amendment would clarify the residency requirements so that an individual who is currently a resident of New Mexico may participate as a medical patient in the program, but not participate as a reciprocal participant in the program. It would help ensure that the purpose of reciprocity, which is to allow individuals who travel from their home state to obtain medical cannabis during their visit to New Mexico, are able to do so. And that when purchasing medical cannabis, the individual who is selling the cannabis would need to verify that the person is actually participating in a medical cannabis program where they are enrolled. The proposed amendment to the rule clarifies the exception for New Mexico residents who are members of a New Mexico Indian Nation, tribe, or Pueblo medical cannabis program, and their ability to participate as a reciprocal participant in the New Mexico Department of Health medical cannabis program. The proposed amendment would modify the reciprocal limit to 230 units for 1 year, which would still allow for individuals who are traveling to New Mexico to have access to their medicine during their travels through the state. The proposed amendment would modify the requirement and require the licensed nonprofit producer who is selling an individual medical cannabis as a reciprocal participant to verify their proof of authorization with the individual's place of residence and ensuring the individual meets the qualifications of the reciprocal program, and to record this information in the registration and verification tracking system. The proposed amendment would ensure the reciprocal participant is enrolled in a medical cannabis program from the originating state or governmental entity by providing proof from a governmental agency of the participant's enrollment in that particular locality's program. This will help to ensure that the medical practitioner is in good standing with their licensing body and that the reciprocal participant has met the eligibility requirements of the originating jurisdiction. Thank you very much, and I appreciate it.
Thank you for that information. Now, at the last meeting, this discussion was tabled. In order for us to move forward with discussing it now, we must first make a motion to untable it, second it, vote on it, and then we can begin discussion on this issue. Additionally, I also note that Alan Plymel has joined us. Welcome, Alan. Would you like to introduce yourself to those present today? We can see that you are speaking with us, but unfortunately you are on mute. I will continue to move forward with the meeting, and if you are able to address us in the future, please feel free to chime in. So at this time, I would like to make a motion to untable the discussion of the proposed rule changes for reciprocity. Is there a second?
This is Jean-Paul Dedam. I second the motion.
The motion has been seconded, and we will now vote in order to untable this proposed rule change. Ariel Bowers.
Aye.
Kenneth Carrazza.
Aye.
Jean-Paul Dedam.
Aye.
Courtney Marquez.
Aye.
Alan Plymo, we can see you. Are you able to join us with audio? If not, if you agree to approve untabling this motion, please give us a thumbs up. If you would not like to untable this motion for a vote of no, please give us a thumbs down. For the record, I see that Alan is giving us a thumbs up. I will enter his vote as aye. Davin Quinn.
Aye.
Stephanie Richmond, aye. Tracy White.
Aye.
All right, we have now untabled the ability to be able to talk about the reciprocity rules, and I'd like to start with that very first paragraph of the 7.34.4.28 with the addition of the sentence, a qualified patient may not be registered to participate as a reciprocal patient in the New Mexico Medical Cannabis Program. I agree with this. I think that it requires that if you're in the state of New Mexico that you go through the enrollment process to participate, and that you're therefore under the care of a medical provider, and that it could also prevent the any double dipping. What does the board think about this inclusion for the proposed rule change?
Hi, this is Jean-Paul Dedam. I also agree with this. I think it, I think it's important to have people who live in the state seeing doctors here in the state rather than, going through certain loopholes in order to get medical cannabis. I do have a question though, and it would fall under the kind of the nuts, how this rule would actually be enforced. How do you define somebody as a resident of New Mexico, number one? Because I assume that, it probably has to do with going to the, when you go to the DMV and you have to show a ID, and you have to show proof of residency with bills and things like that. So that's my first question: is how are folks going to prove that they either are or are not residents of New Mexico? And number two, for folks visiting from another state, how do they prove that they are not a resident of New Mexico and that they live in another state? Is it enough that they have an ID, a driver's license from another state? Or are they going to have to provide, like when you go to the DMV, are they going to have to provide a utility bill in their name and from another state? I just worry that might become somewhat onerous for people visiting the state, and then also for the nonprofit dispensaries who are going to have to verify this information. And maybe this hasn't been determined yet, but I was curious about that.
So thank you, sir. basically, what just happens, and the ability to be able to show verification is really showing the issuance of the government issued ID. So in this case, in New Mexico State, driver's license or identification card. And if someone is, for example, from another state and they are participating as a reciprocal patient, and this is actually addressed a little bit later in the proposed rules, they would also need to show that government issued ID showing their place of residence, so their address. As to it being an additional burden, this was something that, or this is something that, for example, in any store that sells alcohol, they have to verify the ID. So that is not considered to be an onerous burden for the individuals and for the locations. Those are very good questions and concerns. And we did look at it from that aspect and that perspective, that we wanted to make sure that individuals had an easy way to be able to show where their residency is. And that's why the only thing they need to do for that is to show their government issued ID, their state issued ID, to be able to show their actual place of residence. Thank you.
One quick follow-up question, because I just had this circumstance where I was seeing a patient in clinic who lived in another state for many years. I think his license is in that state, but he recently moved to New Mexico. He plans to spend I think 9 months out of the year here and then go back to this other state during the summertime, essentially as like a snowbird situation. Now, I think he lives in New Mexico. He has an address here, but I think his license is still from this other state. So will his application for for the medical cannabis program in New Mexico, even though he's residing here, will that be rejected until he gets a New Mexico license?
Another great question. So New Mexico, and maybe Chris Woodward might be able to clarify this a little bit, but it's either in the law or in regulations that if someone lives in New Mexico for more than 6 months, they are declared a resident and actually are required to switch over and get a New Mexico driver's license identification. And so in that case, that is actually covered under other aspects and not under medical cannabis. And so they would need to see about seeking out that residency. And am I correct in that, Mr. Woodward?
Dr. Zillow, I believe that is correct. I believe that is covered under the regulations, tax and revs regulations regarding driver's licenses. So if it's anywhere, it is in their regulations.
Hi there, this is Ariel Bowers speaking. Dr. Zerlo, I have a question in regards to whether the Department of Health has been able to, have you looked at how different states verify that patients are eligible for medical cannabis? Like, does everybody have a card from another state with kind of the dates of eligibility, so an expiration date on that card, or do different states do this differently? Like, was this looked at and considered when these regulations were written?
Thank you. Yes, we did look at what other states do, and it does vary. However, what we looked at is we also determined that for the basis of New Mexico, because patients, when they enroll, are already required to verify their place of residence as a medical cannabis patient, that this would be consistent to do so across the board, not just with medical cannabis patients, but also with the reciprocal participants. And therefore, to make it fair and even and to make it equitable with the current medical cannabis patients, that was part of why we decided and looked at having individuals be able to show that identification in order to be able to participate as a reciprocal participant.
This is Davin Quinn. I'm in support of this. I think it's a good idea and it makes sense. Thank you.
I agree. I also am support of the residency requirements and the that the qualified patient can't participate as a reciprocal patient as well. I didn't have any concerns about the further definition of the A3B for the New Mexico residents. I thought that that language was also reasonable. Did the other board members have any concerns regarding that section?
Davin
Okay,
Quinn, no
excellent.
concerns.
Thank you. All right, and then what do you guys think about the section B for the reciprocal limit? This is what was most of our discussion last time. I have been thinking about this, and I think a lot of our discussion at our last meeting was surrounding like the concerns about, we certainly recognize that there have been people that have been displaced by COVID-19, that we have students living in the state, that snowbirds are here, and then trying to balance that with how long people are in the state. I certainly think that New Mexico has also established that any people living in the state for longer than 6 months should consider getting a license if they're planning on staying here for longer periods of time. I'm also interested in making sure that the patients, the reciprocal patients, would have access to their medication. I also think that we also have to be able to have some protections for the New Mexico participants in the medical cannabis program. And there's also been so much discussion too about what constitutes the adequate supply. And I'm honestly really hesitant to start tying in such specifics of the total amount of units with the units and a time frame, because then any time that we talk about the adequate supply, then this is something that we're also going to have to be revising moving forward, and that could seem burdensome moving forward. I think I was also reviewing like how medical cannabis programs are in other states. Like in Colorado, medical cannabis participants are able to purchase twice the amount of the rec or patients, or the adults purchasing the recreational amounts. One of the things that I thought that could help maybe with the ease of language and with protecting the New Mexico medical cannabis participants would be to not necessarily specify the time frame or the total units, but to include some language that would essentially cut that in half so that it would allow someone that's supposed to be here just half of the year to still be able to have access to the medication, but maybe not at the full amount of what the medical cannabis participants are allowed to have. What are your guys' thoughts about that?
So this is Jean-Paul Dadam. So your concern is that that the supply for state residents would perhaps be limited if we allow the folks from other states participating in the reciprocal program to get as much as the residents. I don't know. Am I understanding that right? Because from my standpoint, I mean, I guess I would say let's just keep it simple and basically say that they have the right to the same amount as residents during the same period of time, and that way we wouldn't, if we change the amount that patients are due, this would automatically go up, or it would be it would be equal. But those are my thoughts.
Yeah, I hear what you're saying. I agree. I do think that you should be able to have the same amount. I think then kind of where I was trying to also come up with some language to be able to recognize that if someone is living in the state for more than 6 months, that they should be under the care of a medical provider here. That's what I'm trying to figure out how to address. I agree. Like, I think that I'm not saying that they, like, so they would have half of the amount that is allowed for the qualified patient, like over the course of a year. So just so that because if you're a reciprocal patient and like if you're like you're living in Texas and you're coming over, then you potentially could have access to the same amount as a New Mexico resident. And I think the thing that we were having a hard time discussing last time was how do we address those patients that are in the state for longer than 6 months?
Yeah, this is Jean-Paul Dedam again. I'm not sure. I mean, we could I think the easiest thing to do would just be to keep with the state driver's license law and limit it, and basically limit them to 6 months. If they're here for longer than 6 months, then they should get a New Mexico driver's license. But then once again, are we potentially impacting students and snowbirds and what have you? I don't know. I at this point, I think I would be in favor of just keeping it simple and keeping it with state recs and saying, they can get up to a 6 month supply, and then at that point, they would be considered residents of New Mexico, and they would need to, become New Mexico residents and become enrolled in the program here. I think that would just be the simplest, and and then maybe there are some unintended consequences, but it's something that we could that could be reviewed at a future time.
I think this is Ariel Bowers speaking. I think it makes sense, for our reciprocal patients from out of state to have like the same amount as the in-state New Mexico folks in terms of medical cannabis. And I think this may already be written into these proposed regulations, actually, from what I remember reading them. I'm wondering if it makes sense to, have like an appeal process through the Department of Health, similar to, like when our patients need more than the amount that is regulated. So I would be curious about whether out-of-state patients could apply for some sort of extension or some sort of waiver. Maybe it takes them a little while to get in with a provider after they've moved here. But does that make sense? And Dr. Zerlo, do you think that that would be feasible?
Thank you. That's actually definitely something that we could take under consideration. Just as a point from an administrative standpoint, that could be very complex because, as an example, the current requirements with regard to a patient being able to receive the additional 4 ounces if needed requires a visit with their medical provider and a letter from that medical provider. And so one of the things we would need to consider with regard to that from an administrative standpoint is, where do we actually get that type of a letter from? And so that's something that we could consider. But if we did that, we would definitely need some additional support and help, especially from our advisory board members, as to what the best way to really determine how we can ensure that that patient needs that additional medication, that they're receiving that additional medication, and who should that come from? Can it be any provider? Can it be a provider? Must it be a provider from their home locality? And so I think those are some things we would need to consider. But I think that's something that the program would be open to.
Hi, this is Courtney Marquez. I agree with Ariel as far as having some sort of extension or some policy for extenuating circumstances, because just for an example, with for a student to ask them to change their state of residency, they might be under their parents' insurance or something somewhere else, and then that would affect that. I mean, there would just be different things that could be impacted by that, and then that would be a concern. So I would agree with having something that I know it would definitely create more paperwork, but or more. But I think it would be the number of people that would be. I don't think would be huge, but it would also be something that would be important for those people to not have them maybe necessarily lose benefits or impact them negatively as well.
Again, this is Ariel Bowers speaking. So I think also that, being like I provide care for some college students who go to school out of state and, continue that care via telehealth. And, like thinking about it from the perspective of being a New Mexico provider, like I would be happy to write them a letter for a medical cannabis agency out of state, so that they could maintain their medicine out of state. And I think that it makes the most sense for the continuity provider to be writing those letters. I mean, I think that my second choice would be for, so if I had a patient who was say from Arizona and who was here in New Mexico for some reason and needed to stay a resident of Arizona, but needed to extend their medical cannabis care here, then, I mean, I think I would also be completely comfortable meeting with them and writing a letter to extend that for maybe a 6-month period while they finished up their business in New Mexico. So I personally think that the letter could come from either that person's home state with their continuity provider, like their regular person, or like a New Mexico provider.
I think one of the things that also came up at the last meeting was the quantity, and it seemed that the general consensus was that the quantity of the 230 units per year time frame was not something that the fellow board members felt that was sufficient for the reciprocal patients. Is that correct? Do you guys have any other thoughts about that moving forward?
This is Jean-Paul Dedhomme. Yeah, I agree. I think it should be. I think they should have access to the equal amount as New Mexico residents within that 6-month time period. And I also wholeheartily agree. I think that Ariel Bowers' idea about having an appeal process for people who are going to be here longer, that I think that would help give the people, unfortunately, that might be affecting by creating this rule, that would give them a means of getting access to the medication they need. So, thanks.
Yeah, I like that idea as well, because you can file for an extension right now if you feel that you're needing a higher quantity limit. So I think that should also be extended to the reciprocal patient. So I do like that idea a lot as well. And then it also still allows patients to be able to have that kind of access. So then when I just look at the language of that, the section B, if we were to make any kinds of, if we were to approve it and then vote to modify it, if we did any kind of the modification, we would say that it would equal the same amount of the units that a New Mexico participant in the program would have access to. But then when we limit that as a time frame to 6 months rather than a year, just thinking of like how we're going to write it up to propose it, move to the secretary.
Hi, this is Davin Quinn. I agree that the language to basically say they can have up to the same amount that a New Mexico resident would have for a period of 6 months.
And this is Ariel, and yeah, that seems consistent with the regs regarding like ID in New Mexico residency anyway. So that makes sense to me too.
Excellent. Anybody else have any? I see you're up some, Alan. Thank you very much for the record. And then does any of board member have any other comments about the reciprocal limit before we move forward? We can always have some further discussion about this. But I think then the other amendments or rule proposed changes are also in sections 5 through 7, and then for D, proof of authorization, refusal of service, and informational. Oh no, that was not. It was, sorry, just with the D for proof of authorization. Did any of my fellow board members have any concerns about how this will then affect the licensed nonprofit producers to verify their enrollment when they go to the dispensary to get the medication?
No, I'm satisfied with Dr. Zerlo's response. Sorry, this is Jean-Paul Adam. I'm satisfied with Dr. Zerlo's response. Thank you.
Yeah, this is Ariel Bowers. I have no real concerns about that right now.
This is Ken Carrazza. I agree with Dr. Zillow's response.
Okay, so before we have a motion to adopt any of these changes, does anybody have any final comments?
Davin Quinn, no comments. Make a motion to approve modifications.
Okay, so just for clarity moving forward, I will propose that we make a motion. I'll ask for a second to adopt the changes. Then I think we need to vote again that we would like to be able to make a modification to it. We can discuss the modification and then we can vote on the modification just for absolute clarity for the record. So is that an appropriate point of procedure? I'm asking Chris Woodward that question.
I'm sorry. Could you repeat that? Could you repeat the question? I understand that you want to segment your votes into parts.
Yes, and I at our last meeting we had votes to approve with modification, and then we had to further clarify that as point of order in approving our last minutes. So just for clarity, if we first approve some of the recommendations, take a vote on that we're going to approve the rule changes, then we make a motion second to make a modification, then we discuss the modification and vote on the modification.
Sorry. So you would be voting to recommend in favor of the proposed regulations, and then you would be making a vote to modify the vote that was already taken. Do I understand that correctly?
That is one suggestion. I'm asking for your guidance on point of order so that I know. So like, because last time we did the, yes, we approve it, but with this modification. So just logistically, how do we move forward with this?
Well, you know, these logistical questions are always tricky. And we run into this kind of issue in basically every type of board meeting that we have, where, you know, especially when there's multiple parts to what you're voting on and trying to figure out how to make a clear record. And so that of course is our objective here, just that there be a clear record of exactly what the vote of the advisory board is. And so I would say I don't recommend voting in favor of you know, recommending adoption of a proposed rule and then having separate votes to modify a vote that's already been taken. I think that generates confusion and it doesn't make for a great record. I think to the extent that you're able, I think the best practice is to basically put it all into, if you can segment portions of the rule to where you say, for example, I move that we recommend in favor of this portion of the rule with such and such caveat. And to the extent that I think if you can split up the portions of the rule that you want to address and then specify the sort of caveat to it as part of the motion, that probably is the best approach. I think that would make for the best record.
Okay, thank you for that clarification. I appreciate it. Oh, I'm sorry. Did someone else make a comment? Yes, Davin, please.
Hi, Stephanie. This is Davin. Yeah, I agree with what Mr. Woodward is recommending. I suggest that there be a motion for each modification, a second for each modification, a vote for each modification, and then a vote on the completely modified total document. Motion, a second, and a vote on the completely modified total document.
Okay, so I appreciate all of your patience and input for making sure that the record is clear, because I do feel like this is an important issue and I would like our recommendations to be clear for the record to go to the secretary. So in our conversation then, as part of that first paragraph for the 7.34.4.28 for reciprocity, there is an inclusion of the sentence, a qualified patient may not be registered or participant as a reciprocal patient in the New Mexico Medical Cannabis Program. From our recent conversation, it was indicated that there wasn't any opposition from any of us that we would like to do any kind of modification to this. So for this portion of the rule, I move that we adopt this as part of the new language. Is there a second?
This is Tracy White. I second that.
All right. The motion to approve and the sentence has been seconded. We will now move forward with a vote to adopt the inclusion of this sentence. So Ariel Bowers, do you please vote aye or no? And Alan, I can keep my eye out for your response as well. Ariel Bowers.
Aye.
Kenneth Carraza.
Aye.
John Paul Dedam.
Aye.
Courtney Marquez.
Aye.
Ellen will give us a thumbs up for aye or a thumbs down for no. For the record, I see Alan's thumb up for aye. He is nodding, so his vote will be entered as aye. Davin Quinn.
Aye.
Stephanie Richmond, aye. Tracy White.
Aye.
All right, so we have voted to approve that the qualified patient may not be registered or participant as a reciprocal participant in New Mexico Medical Cannabis Program with a unanimous vote. All right, so then for the next adoption of the rules, it is involving the Section A3 that further defines the residency requirements of A and B for non-residents and New Mexico residents. There wasn't much conversation about any kind of opposition for adopting this portion of the rule. Is there any other conversation that the board would like to have prior to making a motion to consider adopting this portion of the rule? All right, so I make a motion that we move to vote for the residency requirements for residents and non-residents of the reciprocity rule changes. Is there a second?
I'll second. This is Ariel.
Thank you, Ariel. The motion has been seconded. We will now move to a roll call vote to include the residency requirements that have been proposed by the department without any modifications. Or please answer aye or no. Ariel Bowers.
Aye.
Kenneth Carrazza.
Aye.
John Paul Dedam. Courtney Marquez.
Aye.
Ellen Plymall. I see Ellen Plymall thumb up. This indicates his vote as aye. That will be entered into the record. Davin Quinn.
Aye.
Stephanie Richmond, aye. And Tracy White.
Aye.
Excellent. All right. The board has moved to include the residency requirements as they have been proposed to us. All right, and the next section is section B for the reciprocal limit. And this, I think we may need to get into some specifics of the language just so that we are all clear on this. We could say that the reciprocal, okay, well, let's do this. Can we, and please chime in, Chris, if you think that this is fine procedurally. So I make a motion to modify the reciprocal limit. Is there a second?
I'll second. This is Ariel.
Thank you. Ariel has seconded my motion to make a modification to the reciprocal limit as it has been proposed to us. I would like to take a roll call vote to approve the modification. We'll then talk about the modification and then vote on that.
Madam Chair,
yes, please.
I think that for purposes of a motion on this, I think it's true that the ordinary practice is motion, second, discussion, and vote. But I think in order to, I think you can do this a couple of different ways. But I think you don't want to have a motion that doesn't specify what the suggested edit is. Does that make sense? In other words, a motion would be, I move that we recommend in favor of this particular edit, that for example, that the possession limit be specified as such and such. So I think maybe the better thing to do would be to rescind this motion. And then if you wanted to have some discussion in advance of the motion, you could do it that way. You could have some discussion about what you think an appropriate limit would be, and then call the motion. The other approach is to do a motion where you move that the limit be such and such, you get a second, and then you have further discussion about it, and then either the motion carries or the motion fails. But I think that's how I would do it. I wouldn't do sort of an open-ended motion that doesn't specify what the requested edit is. Does that make sense?
Yeah. Okay. So I rescind my previous motion. Is there a second on me rescinding the motion?
This is Ken Carrazza. I second that motion to change.
Thank you. The motion has been seconded. Okay. So now I propose that we talk specifically about how we would like this language to appear for our proposal for the modification, and then we can vote on that modified language. So I think that we are all in agreement that the language should reflect that, well, it's open for discussion. So I propose that we say that the reciprocal patients have the same, that they have equal amounts, but perhaps that we also limit that to a time frame of 6 months, with the understanding that there can be an appeal process to file an extension for patients that may be in the state for longer periods of time. Is that my correct understanding? Do you guys have does my fellow board members have other input for the language specifics?
This is Ariel, and I agree with that kind of general assessment.
This is Jean-Paul Dedam. I also agree.
Okay, so then just looking at the specifics of it, the modification then could state that a reciprocal participant may collectively possess within any 6-month period a quantity of usable cannabis that is equal to, this is where I'm getting hung up. I need some help from you fellow board members on how to make sure that this language is reflecting our intent.
How about consistent with limits to New Mexico license holders?
I like that. The other language that's used in the rule, just thinking of the other thing that we already adopted, is a qualified patient. So I guess we could have that same language to keep it consistent. Okay, so consistent with limits allowed to the qualified patient. Okay, so then just to read that again, it would be reciprocal participant may collectively possess within any 6-month period a quantity of usable cannabis that is consistent with the limits allowed to the qualified patient. How does that sound for the modification? Now's the time we're talking about it. I'm not making any kind of motion to vote on it. If anybody has some other points that they'd like to clarify at this time, now would be the time to do it. All right, so I make a motion that we adopt the reciprocal limit.
Do we want,
yeah,
I don't know, but do we do this is Ariel, do we do this one piece at a time, like one change at a time? Or do we add in the piece about requesting an extension from the Department of Health, you know, like with a letter from their own provider or a New Mexico provider? Like,
yeah.
I don't know the rules, which is why I'm asking.
Exactly. No, I really like that question too, because I'm not sure, because the qualified participants in New Mexico can also file for an extension. You're right. That is a really good question. I don't know how that rule is included now with it and what kind of language is used there. Does someone from the department, could they provide us with some guidance on this question, please?
Hello, thank you, Chair Richmond. This is Dr. Zerlo, and basically, at this point, you don't necessarily, because this is a recommendation, you don't necessarily need to have the exact language, just really the intent. And again, I would ask Mr. Woodward, am I correct in that?
Yes, I think that's fair. I don't know that there's any sort of established method. I don't know that there's any one way of approaching this. I think the goal here is always just that the intention of the advisory board is clear from the record. And so, I think that it's possible to combine things into a single motion if you feel like everyone is on the same page about the items in that motion, but it's also possible to segment them if you think that that's preferable. But from the sound of the discussion, it sounds like folks are more or less on the same page about this. So for this piece, you may want to just put it all into one motion. And I agree with what Dr. Zerlo just said, that as far as the specific scope, because this is a recommendation regarding the department's rule, again, just so long as the intention of the advisory board, the recommendation of the advisory board is clear, the nuts and bolts of it can be worked out down the line.
Well, that's a relief. Thank you.
Madam Chair, this is Ken Carrazza.
Yes.
Dominic, do we have a AG representative for this board at all?
I'm sorry, do you mean an Attorney General representative?
Yeah,
AG?
To write the correct language is what I'm asking. I'm sorry.
No, that's okay. I just wanted to clarify. That's actually part of, again, why we have Mr. Woodward. He is our acting general counsel for the department with regard to that. And that's where I think what we're saying is, as long as we have the intent, we can work as a department on the specific language and ensure that it meets the intent that you're expressing.
Thanks, Dominic.
Okay, so the modification then that we are discussing would be that a reciprocal participant may collectively possess within a 6-month period a quantity of usable cannabis that is consistent with the limits allowed to the qualified patient. And the reciprocal patient may have an appeal process to file an extension. How does the board feel about that kind of language to also embody our intent?
Do we want to clearly state how long an extension we should be talking about? I think it makes sense to be able to file for another 6-month extension, right? To have kind of this initial 6-month period that's reciprocal, and then to be able to extend it by another 6 months. Does that make sense to other people, or do we want to keep it nice and vague?
This is Jean-Paul Dadam. I'm perfectly happy with the with your suggestion of the 6-month extension.
Yeah, I also agree. with the ability to be able to file for the extension. Do our fellow board members have any other comments at this time? Okay, so I make a motion to modify the language in the reciprocal limit. Is there a second? Or sorry, for clarification, I make a motion to modify the language of the reciprocal limit to state that the reciprocal patient may collectively possess within any 6-month period a quantity of usable cannabis that is consistent to the limits allowed to the qualified patient. The reciprocal patient may have an appeal process to file an extension for an additional 6 months. I make a motion to adopt that as a modification. Is there a second?
Ken Peraza, a second.
Perfect. That motion has been seconded. Now I would like to take a roll call vote. Ariel Bowers.
Aye.
Kenneth Peraza.
Aye.
John Paul Dedam.
Aye.
Rachel Goodman. Sorry, she's not here. Courtney Marquez.
Aye.
Alan Plymel. I see Alan's thumb up and will record his vote as aye. Davin Quinn.
Aye.
Stephanie Richmond, aye. Tracy White.
Aye.
All right, we have approved it by unanimous vote the modification for the reciprocal limit. Now, the next items are under C. I guess there is this C2 that the language to change is to compare an individual's proof of authorization from the other state to the government issued photo ID and to verify that the information about the place of residence is consistent. How do board members feel about this as the proposed rule change? I don't really have a problem with it. I mean, we've already kind of established that this is something where if you're if your residency requirements say that you are participating in a medical cannabis program in another state, that you have to be able to provide both forms of identification. But I'm open to comments from the board.
I'm perfectly happy with this as well. This is John Paul Dedam.
All right, so I move to adopt the language in 7.34.4.28C2 without modification. Is there a second?
Davin Quinn, second.
We have approved to move forward with a vote. I would ask Ariel Bowers to enter aye or no.
Aye.
Kenneth Peraza.
Sorry, aye.
Thank you. John Paul Dedam.
Aye.
Courtney Marquez,
Aye.
Ellen Plymal has a thumb up. I will enter his vote as aye. Devin Quinn,
Aye.
Stephanie Richmond, aye. Tracy White.
Aye.
All right, we have voted to approve 7.34.4.28 C2 without any modifications. The next is proposed rule change is for 7.34.4.28 C4. A licensed nonprofit producer shall not register an employee or board member of the producer as a reciprocal patient. Well, okay, with 4 through 7, do the board members have any concerns with any of that proposed language, with the idea of thinking that we may want to do any kind of modifications to that language, or is there any discussion about how to, if we want to do any modifications, I guess? Doesn't seem that there is any opposition to the proposed language for 7.34.4.28 C5 through 7. I make a motion that we adopt the language as written.
I'll second. This is Ariel.
Thank you, Ariel, for this second. Let's move forward with the roll call vote on the adoption of that language. Ariel Bowers.
Aye.
Kenneth Carrazza.
Aye.
John Paul Dedum.
Aye.
Courtney Marquez.
Aye.
Ellen Plymal. Thumbs up, entering as aye. Devin Quinn.
Aye.
Stephanie Richmond, aye. And Tracy White.
Aye.
All right. The next proposal of rule change is for section D, proof of authorization. So it's my understanding of this, the intent of this proposed rule change is that the reciprocal patient would need to show a card or other physical document in order to, that allows them to participate in the medical cannabis program, and that permission from a medical practitioner shall not in itself be deemed proof of authorization to participate. Good. I think that kind of splitting hairs is that a card or other physical document, but the other physical document isn't a letter from their provider. What do you guys think from fellow board members?
I think that this is Ariel Bowers. I think that as long as what the patient has is consistent with what their state requires, then I think it makes perfect sense for them to be a reciprocal patient, right? If they have identification from that state, and then they have the documents from that state that are consistent with what that state would be using for their medical cannabis program, then I think it makes sense for New Mexico to be able to, qualify them as a reciprocal participant.
So what if the state recognizes that their medical provider just has a letter, and then they come to New Mexico and they say, well, my state allows me to just have the letter, and we say, sorry, we don't accept your letter?
Yeah, I think that's tricky. And I think also, I'm hoping that they looked at this when they made this rule, right? And it specifically says no letters, and so that makes me wonder. So does anybody from the Department of Health have any clarification on this? Because I do want to make sure that people from other states, if what their state requires is a letter, that they can use that letter in New Mexico and still get their medicine. Have you looked at that yet? And what have you found?
To the chair and Dr. Bowers. So this is Dr. Zerlo, and the issue with regard to that is it doesn't actually bar a letter if that letter is from the issuing author or authorizing agency or a governmental entity within the state that actually oversees that particular location or jurisdiction's medical cannabis program. What this is in the intent of this is to actually help to relieve the burden of trying to have the licensed nonprofit producers prove that a letter that is simply presented to them is indeed a letter from that provider, or is indeed a letter from a medical provider who is in good standing within that jurisdiction. Because since the reciprocal participants register at the point of sale with the licensed nonprofit producers, without having that, the burden of providing that proof would fall not to the reciprocal participant or the proposed reciprocal participant, but to the licensed nonprofit producer. So they would actually have to research and find out, is that provider in good standing? And did that provider actually issue that letter? Which may not be possible if, for example, someone was coming at 9 or 10 o'clock at night on a weekend when the provider is not available. And so the idea behind this and the reasoning behind it is because we have seen some forgeries that have occurred already. And so we need to limit that and ensure that the reciprocal participants who are able to participate within their jurisdictions are indeed able to do so regardless of the time or particular day. What this also allows, and for example, it does have with regard to California, in California, individuals can indeed, if they are residents of California, can get a letter, but they also have the ability to enroll in the state program also. And so this does not prohibit a resident of California from participating because they can also still enroll in their state program. So we did look at that. The issue we really have had is, again, individuals going online and printing out letters, some of which we have determined are from individuals who are not necessarily in good standing and would not be considered in good standing.
So this is Ariel, Dr. Zerlo, just to clarify. So it sounds like people can bring verification from their state, which could include a letter from the medical cannabis program of their state. Okay, or it could be like a card or other form of identification.
Right, that is correct. So what it states specifically shall be accompanied by a card or other proof of enrollment issued by an authorized governmental entity of the originating jurisdiction. And it's to cover exactly that. If there is a location or a jurisdiction, which may even in the future occur, where they're not necessarily printing out a card, a physical card, but maybe utilizing some other form or method, including a little electronic means.
This is Stephanie.
Okay.
Sorry to interrupt you, Ariel. This is Stephanie. I have a question for Dr. Zerlo. So does California also, though, with some providers medical providers that are in good standing, they have letters that it's still an approved form for them to be enrolled in their state? I totally understand wanting to make sure that we're avoiding any kind of fraudulent things, but I also think that if someone is under the medical care, they have received a letter from their medical provider, and the letter is something that's recognized by that state. Now, is this kind of putting an extra onus on the reciprocal patient to also get additional documentation that would then meet our standards?
Well, it would meet the standards for being enrolled in that state jurisdiction. And so, for example, in California, to show enrollment in their medical cannabis program, someone does have to enroll at their local or their county public health office in order to be an official participant in the California state medical cannabis program.
This is Davin Quinn. I think that the language as it's currently written, it seems to strike a balance between not putting too much onus on the producers and not too much onus on the patients. So I agree with the way it's written. Thanks.
Thank you, Davin. That's Stephanie. Is there any other discussion about how we want to iron some of this out from the board members before moving to adopt it without any modifications?
This is Ariel. I mean, I think I hear that that also, what we're trying to help with, in terms of this regulation is fraud, and trying to, kind of decrease people's ability to print a letter off of the internet, and then have that be completely unverifiable at the dispensary level. And so I think it's okay. Like, I don't have any modifications that I would recommend.
All right, so I move that we vote to approve the proof of authorization without any modifications. Is there a second?
Davin Quinn, second.
Thank you, Davin. Let's do a roll call vote. Ariel Bowers.
Aye.
Kenneth Carrazza. We'll circle back to you. John Paul Dedam.
Aye.
Courtney Marquez.
Aye.
Ellen Slimel. Thumbs up. Vote entered as aye. Davin Quinn.
Aye.
Stephanie Richmond, aye. Tracy White.
Aye.
Kenneth Carrazza.
Aye.
All right, we have voted to approve that language without any modification. I think that we are now complete with our recommendations for the reciprocity rule. Yay! Now let's move on to the next item on the agenda. We are now at the portion to discuss considerations of petitions. We do not have any new petitions that have been submitted since the last meeting of the Medical Cannabis Advisory Board. We do, however, have two petitions that were tabled at the last meeting that have yet to be voted upon. Petitioners have been notified that their tabled petitions may be heard today. Petitioners will not re-present the petitions as the Medical Cannabis Advisory Board has already heard the petition and reviewed the petition documents. If the petition is removed from the table, discussion will resume among the board members, and if necessary, the petitioners will be called upon to answer specific questions asked by the board members. Otherwise, the petitioners may reserve their comments for the public comment section of the meeting. All right, so in order, the two petitions that were on the table were for the medical cannabis therapy for seizure in animals and the petition in connection with the determination of an adequate supply. Is there a motion to take the petition 2019-010 to add medical cannabis therapy for seizure in animals from the table?
This is John Paul Ladam. I motion to remove those from the table. Muted. Sorry, we couldn't hear you.
I'll second, this is Ariel, I'll second to detable it.
This is Jean Paul. Elizabeth, you're still muted. I don't know how.
Stephanie, we still can't hear you. You might try logging out of the meeting and then coming back in to see if that will alleviate your mic. She's unmuted, but I'm not sure what happened there. We are currently advising Stephanie to rejoin, so just hang on 1 minute, see if we can get her mic resolved.
And again, please bear with us. We're trying to work on the technical difficulties. Sorry for the delay.
Thank you. All right, I apologize for that. So we were in the middle of taking a vote to untable the discussion for the petition of the medical cannabis therapy for seizure in animals. Ariel Bowers.
Aye.
Kenneth Carrazza. I'll circle back to you. John Paul Dedam.
Aye.
Courtney Marquez.
Aye.
Alan Pliable. I see Alan's thumbs up. Enter his vote as aye. Davin Quinn.
Aye.
Stephanie Richmond, aye. Tracy White. I don't hear Tracy. Let's see if I can see her. I don't see her either. Is Kenneth Carrazza able to give us a vote? Okay, well, regardless, we have a quorum to be able to table the discussion for the petition regarding the medical cannabis therapy for seizure in animals. I know that at the last meeting, there was some discussion about this and some concern about how we are not practitioners of veterinary medicine. I think that we, as a board, also recognized that that there is some compassionate use for this as well. I know that we had some questions about the stance from the New Mexico Vet Board, and I had reached out to the New Mexico Vet Board to ask what their position was regarding this, and was advised that they take the stance from the American Veterinary Medical Association. And it seems that that association has some concerns about there being some limited peer review and published information, a lack of FDA approval for their therapeutic use, and the labeling concerns, that there seems to be a variation in the potency between human and animal products, and that a potential could exist for high concentrations of the cannabis that could increase the risk of toxicosis for the animal, and that they also, of course, had some concerns about vets that were recommending this and then being subject to some legal risk. I certainly appreciate the spirit of the petition, but I also think that perhaps this may be better pursued for the petitioner to consider submitting for other rule changes so that vets could be considered exempt from any kind of litigation if they were to pursue this. I just think that it gets kind of tricky when one board is telling another board what to do. I see that logistically this could also be a challenge for us as providers because we are not vets. What does the board feel about this petition?
This is Adam Quinn. I definitely feel like this seems to fall outside of our jurisdiction, outside of the scope of this Medical Cannabis Advisory Board for human beings. So I think we have separate medical that oversee medical care from veterinary, boards. So I do agree that this strikes me as falling outside our jurisdiction.
This is Jean-Paul Adam. I agree with Davin Quinn that while once again I am sympathetic to the cause here, I unfortunately don't think that we have I mean, we are established as an advisory board to make medical recommendations for people. We cannot, as a board, make recommendations for animals. I don't have that expertise.
This is Ariel Bowers. I think that if, I mean, I agree. I do not have the medical expertise in terms of caring for animals with seizures to recommend medical cannabis. However, I do think that if there was a really strong and very firm advocacy wing coming from folks in the vet board or folks, from the veterinary community, and they were really seeking support from the medical Cannabis Advisory Board and submitted their application to us and were willing to serve as expertise for care of animals. If this was the only way to get this approved would be, or considered is through this board, then I would be willing to hear it again. But at this point, I don't think that I'm willing to move forward with it.
All right, at this time then I make a motion to not approve the petition of 2019-010, add medical cannabis therapy for seizure in animals. Is there a second?
Davin Quinn, second.
Thank you, Davin. Let's do a roll call vote. Ariel Bowers.
Aye. Wait. We're voting to not approve, right? We're declining this?
Correct. We are voting to not approve. So if you want to not, so then vote to not approve as no. We're not approving it. Is that correct? Am I getting hung up on some of the language, Chris?
No, that made sense. As I understand it, the motion is to not approve the petition.
Thank you.
So then an aye vote is not approving, so aye.
Yeah.
Thank you, Ariel. Kenneth? I'll come back to you, Kenneth. John Paul?
Aye.
Ken Carrazza, aye.
With Ken Carrazza, are your vote entered of aye would be to approve the petition?
No, I'm to tabling it or whatever you want to do.
The motion on the floor right now is to not approve the petition.
I'm in favor of not approving the petition.
Thank you. John Paul.
Yes, I'm in favor of not approving the petition.
Courtney.
Yes,
Yes. Alan. He is voting thumbs up to not approve the petition. Davin.
Vote to deny the petition.
I also vote to deny the petition, and Tracy White.
I also vote to deny the petition.
Okay, we have voted unanimously to not have the petition included. Is there a motion to untable the discussion for the next petition, 2020-001, the Medical Cannabis Advisory Board petition, connection with a determination of an adequate supply from the table?
This is Ariel Bowers. Yes, I move to untable this.
I second it. In order to untable it, we need to do a roll call vote. So Ariel Bowers.
Aye.
Ken.
Aye. Ken Carrazza.
John Paul.
Aye.
Courtney.
Aye.
Alan. He is voting thumbs up. Vote will be entered as aye. Davin.
Aye.
Stephanie, aye. Tracy.
Aye.
All right. We are now in discussion of the petition. At our last meeting, we had a lot of conversation about making sure that the participants had adequate supply, and I'd like to kind of pick up from that conversation. I think that we were all concerned about making sure that there was an adequate supply, and that the plant count limit also seemed that we would perhaps always be kind of behind 120 days at the harvest time, and that we were going to also need to be revisiting this frequently. I think some of the concern that the board presented us was also about some regulation. I'll open it to the floor for somebody to give some input about this petition.
This is Davin Quinn. Just to refresh my memory, the petition is asking for all limits to be lifted.
Let me read you from the petition summary. We respectfully request the Medical Cannabis Advisory Board to recommend the immediate suspension or substantially raising the current plant count limit to allow cannabis providers to meet increased patient needs due to the long-term shortages in the medical cannabis marketplace, the recent surge in activity, and the CDC's 30-day supply recommendations. Increased patient needs will be met by immediately allowing producers to substantially increase plants while focusing on much shorter cultivation cycles to enhance harvestable plants and less reliance on outdoor or the traditional 14 to 16-week cultivation cycle. With more plants on a shorter cycle, the industry will reap a quicker harvest turnaround, which will result in medicine reaching patients faster. So yes, they are proposing that we either suspend the plant count limit or substantially increase the plant count limit. This has been a petition that's been presented and discussed by the Medical Cannabis Board in the past, and my understanding from a previous vote is that it had previously been adopted without any kind of specifications as to plant count limit or suspension of the plant count, but that previously had not been accepted by the Secretary of Health.
Thanks so much. I appreciate it.
This is Ariel Bowers, and I remember, from our last meeting, a lot of this discussion centered around supply and how that impacts cost and quality and variety for medical cannabis patients. So in the interest of being able to support decreasing cost and increasing supply and variety to our participants, I agree with this. I think that I understand that there may be some administrative impact, and like the Department of Health can figure out what ways this works for them. It sounded like tracking the plants was a lot of that administrative impact. But I think in terms of being a representative to impact people and impact people who are members of this program and who qualify for medical cannabis, I think that this would make a really dramatic impact on their ability to get quality medicine at a much better price. Because a lot of my patients just can't actually afford their medicine. And so much of that has to do with supply and market demand.
This is Stephanie. I have a question for Gavin. At the end of the last meeting, as this was also getting tabled, it seemed that you had mentioned some suggestions for maybe how else to address this. Did you want to expand on those comments of yours from the last meeting at all?
Hi, thanks, Stephanie. If I recall, I think I said something about sort of these kind of incremental increases that sort of happen perhaps on a intermittent or semi-regular basis, with kind of repeated assessment or evaluation about the necessity and the impact. So I am in agreement with the principle of making the medical cannabis more affordable and available in a safe and responsible manner, and so it just strikes me that getting rid of all limits seems quite drastic. The sort of going completely in the opposite direction, and then was sort of was seeking a middle ground kind of option, I guess, which would be substantially increasing, but increasing with sort of an idea that we'll continue to sort of evaluate this and keep taking a look and making adjustment when needed. So I guess it's sort of a principle rather than more than a hard practical suggestion.
Thank you for that. I understand. It also seems that if we're always looking at plant count limits, then this is going to be something that we're talking about regularly. I think certainly can appreciate that it comes with some regulation. I also think that a lot of this is something that is related to ensuring that there is an adequate supply. Also seems that according to the petition that there is some discrepancy with the reporting. I'm not sure about the ins and outs of that. I'd like the board to address the petition in regards to the discrepancies that the petitioner has listed about counting and how, if they have any kind of input about those discrepancies that were mentioned.
Well, this is Davin again. I recall there being, sort of, arguments presented about the counting methods and the variables. I'm not sure that we're going to be able to reconcile that today or among us. So, which is why I guess I sort of recognize that there's these sort of two positions. There's the state position and there's the producer position, and we're trying to sort of find the best way forward between these positions, understanding that there's probably going to be a tension there, for the foreseeable future. So again, sort of, I guess, even with the discrepancies that were described and sort of the different take on how much is produced and how much is available, I guess I'd still argue for sort of like trying to find a middle ground.
This is Ariel Bowers. I'd like to just kind of clarify that it's not like we would be removing no limits. We would be removing a plant count limit. Like there are some natural limits on growing cannabis. I think the resources that go into each plant are substantial, and then the regulatory requirements in terms of paying fees for the plants that you are growing is another natural limit that we have already. And then we're not, I think I just want to be careful to say that like the plant count limit would, like, removing that would have some impact, but I don't think that suddenly, people would have no limits on whatever they're doing with their medical cannabis growing.
This is Stephanie. I have a question for the department. Could you give us some historical context as to why this was not approved by the secretary in the past when it had been approved by the advisory board previously?
Thank you, Chair. So this is Dr. Zerlo again, and I can't speak specifically for previous secretaries. However, part of the issue and part of the concern is the fact that we actually did this last year expand the plant count, and included with that expansion within the current rules, producers will actually be able to increase their plant count again this next year during the summer by up to an additional 500 plants. And so there is that idea behind that continued growth and it being done in a very considered fashion. The other portion I would like to point out, as I mentioned during the update report, is even last quarter, there were over 20,000 plants which could have been grown under the current system, which were not grown. And so there is indeed, within the current regulations and rules, a lot of room for the licensed producers to be able to continue to expand at this time to meet those adequate needs of the patients. The other thing I would like to just mention, as far as the issue of there not being an adequate supply, as I mentioned earlier, at the end of the third quarter, the producers themselves reported that there were essentially 5 million grams of smokable or usable cannabis in stock, over 5 million, 5.7 million. And the sale for the smokable cannabis during that same quarter was 4.9 million. So at this current time, the production is actually outstripping the sales. And so I definitely agree with Dr. Bowers about the price and the cost and the issues on that. And what we really, as a program and a department, would really like to see is prices reduce. And I think the current production really is showing that those prices could have been reduced. In addition, when the last set of rules were passed and adopted, with regard to fees for the licensed producers, it effectively halved the price per plant for the producers. And part of that was done in order to try to get prices to reduce so that patients would be able to have much more affordable medication. And unfortunately, the result of that has not been very much of a reduction in price, although we did see it reduce some in the third quarter. The program itself would like to see that reduced quite a bit. So we did not see a big reduction in price just simply by raising the plant count. And so the program is exploring other options to see what might be done in order to help reduce that burden to the patients that we see occurring. I hope that answers the question.
So Dr. Zerlo, what you're saying is that we have increased some supply, but it really hasn't impacted the cost to participants in this program very much. What other factors do you think are really impacting costs, and what is the Department of Health looking at in terms of encouraging some reduction in cost to patients?
Well, we are still looking into all of that, and so I don't have an exact answer at this point in time. Part of it also will depend, quite frankly, on what happens over the next 6 months, 6 to 9 months. And so we need to be a little cautious with regard to that. And as I said, we do have that plan in place already so that individual producers can request additional plants this next year. And so that already is in place. But as to what some of the issues and concerns are, why the medication is as high as it is, we have actually been asking that question ourselves. And quite frankly, there's not really been a very clear answer as to why the price remains as high as it has, while the supply has continued to grow in many ways quite exponentially. I wish I had a better answer for you.
Sure. And Dr. Zerlo, one more question. So does the Department of Health also track variety and quality of medical cannabis supply in the state? And if so, how?
We do track as far as the various strains, but as far as quality, that really is done through the testing that each plant has to go through. And that was actually a part of the previous rules to improve and increase the testing. However, those have not yet been being utilized by the producers and the labs yet. They are currently slated to start as far as that testing regarding contaminants and other potential issues with the medication on April 1st.
Thank you for that. And then one more thing. So does the Department of Health have a strategy in terms of how it already increases plant limits? Like, is there something that's written down where, like every year you assess and then go up by a certain percentage or a certain number of plants? Or is it let's see, is it less exact kind of than that?
Well, again, it's actually a system as we did in this last rulemaking or the previous rulemaking where the rules were proposed and adopted to set the plant limits at the 1750 per producer. And then this coming year, they again will be able to actually request an additional 500 per producer. And so that was a strategic plan so that it would allow for that growth within the program. But at the same time, every quarter, we do look at what producers are growing, what they're reporting, what their sales are, to try and evaluate whether or not additional plants are something that is necessary. And as I kind of mentioned, right now, it doesn't show that the additional plants are necessary to ensure that there's an adequate supply. There is an adequate supply. What I will say is some of the times where some of the issues do arise are especially in rural and frontier areas where individuals from a logistics standpoint may not be able to get a hold of the medication that they would like to have. And so that sometimes is an issue. And we have been trying to work with the various producers in order to help relieve that. And I think that has changed and has gotten better over the last year. But it still needs improvement, and we'll still continue to work with producers to ensure that there's better access to the medication in those rural and frontier areas. And so we do look at it, but it is a more fluid system as far as looking at how many grams or units are available every quarter. And what we really have seen is an increase in the availability of those units and those grams. And of course, without saying it, if we see that reduced down, that's when the next stage as far as the potential for other increases would be looked at.
Hi, this is Jean-Paul Dedam. I wanted to, just state that, I share the concerns of most of everyone on the board about, number one, reducing the cost of cannabis, because it is, quite high in New Mexico, 3 times higher than Colorado, and that represents a significant barrier to our patients getting access to medication. I also am concerned about the fact that there is a lack of accessibility to certain strains in New Mexico. But once again, I don't necessarily see that this petition is going to necessarily address either of those concerns. As Dr. Zerlo has mentioned, that increasing the amount that they're producing has not, in fact, decreased the cost. And it doesn't seem like that has changed either in the strain selection. Just as an aside, I think that one of my biggest critiques of the medical cannabis industry is that, for the most part, what is being sold right now are plants that were bred specifically for recreational use, not for medicinal use. And I have a lot of patients who are elderly, and recreational use medications are not appropriate for them. And I think that the state probably needs to do a better job of pushing the medical of pushing more and maybe this is a petition, something that the medical board, as a medical board, something that we can do is to really advocate and push and advise that there's that the cannabis sold is more for that is more directed at therapeutic medical purpose rather than recreational. That's just my 2 cents. As you can imagine, I don't necessarily see, while we did increase the amount of cannabis that everybody can purchase, the number of people actually purchasing large amounts was small, and so I don't know. And there is already a mechanism to increase the plant number. So, anyways, my concerns, and I think this is echoed by most of the people on the board, are not addressed clearly by this particular petition. If the people bringing the petition disagree, then I ask you to maybe format it directly and try and make an argument about why it does specifically address my 2 concerns, which are cost, number 1, and number 2, strains, producing and making available strains that are more medically directed versus recreational strains. Thanks. I don't have that was I feel free to comment on that. I don't have a question.
I completely agree with you, Dr. Dadam. Those are my concerns. Also, would be cost and variety of available medicines, and I really, I also really think about like if and when New Mexico does legalize recreational marijuana, I think that protecting medical use is super important, and making sure that those additional strains that are more appropriate for medical use in many ways are available is a huge part of that. And so again, I don't know if this can actually be addressed kind of in this particular setting of trying to look at this one petition, but these are really important points.
Hi, this is Stephanie. The other thing, I hear the concerns from the board. I also think that at our last meeting, we did vote to increase the purchase limits. And if the purchase limits are something that is increased, then there also has to be secondarily a mechanism to make sure that there continues to be an adequate supply for that. So I hear the concerns that Dr. Dadam was mentioning regarding this. Although I also think that we have to be able to ensure that from the other petitions that we included, if there is some concern about not having an adequate supply, that we need to be able to approve the potential for there being more, since we also just recently approved the increase of the purchase limits. So I don't want there to be like, oh, we have more purchase limits and now we're not allowing a higher plant count. That also seems like it could definitely limit the supply of the medication for the patients. That's my concern about not approving this petition.
Hi, Davin. We also have recommended that we increase the number of qualifying conditions by about 7 new conditions or so, including all anxiety disorders. So I agree that we could see a substantial increase in the number of petitions, and I think that there's an argument from the petitioner side basically saying that the tempo of increases doesn't keep up with the tempo of sort of desire for increased production.
This is Ken Carrazza. If we listen to Dominic, the reports we have are old reports. I think we should just table this to a different time to see what the usage is for the last quarter or whatever it is. There's adequate supply. There's adequate rules that are going to lead to better production. The price hasn't gone down yet, which I think people are looking for. I think at this time we should take a wait and see attitude.
This is Ariel Bowers. Another thing that I'm thinking of is, can we, I mean, this petition is very vague in saying that, we can either remove a plant limit or recommend to substantially increase it. And I wonder actually if one approach may be to say, we recommend that the Department of Health continues to evaluate and increase plant limits appropriately. And we recommend that the Department of Health strategizes to, with the producers to increase variety of strains and decrease cost to participants. Is that an appropriate modification?
Yeah, I hear what you're saying, Ariel. This is Stephanie. I also understand from what Davin is saying that we also, in addition to increasing the purchase limits, increase the amount of qualifying diagnosis. And because of kind of the vague language then of the petition, I think that it would then allow the department to determine how best to go about doing that by at least giving them a framework to say, okay, yeah, we're increasing all of these other things, so we're going to need more lamps. So, and then the logistics of all of that can kind of fall out with the department too. I think we need to be able to say that we have the adequate supply to give to the people that we're including in the program too. So I think more about approving the petition. I get it that it's also vague. We could, as part of our recommendations, also just not necessarily get in the middle of saying what we think the plant limits should be, but it also at least then recognizes that we are going to need more because we're increasing the access. I also want to recognize Kenneth. Like, I understand that you have some concerns about tabling this. I also think that this, I would really like to get some finalized information from the board for recommendations, because I think we have a new Secretary of Health. We're looking at going into the long session where the recreational is going to be something that is going to be addressed. And I'm not in favor of tabling this right now, because I'd like to be able to give some finalized recommendations before the end of the year so that we're ready to go for this next legislative session. Okay, so then oh, please.
Stephanie, hi, this is Davin. I would propose that we modify the petition, just as we've modified previous petitions, to say that we recommend significantly increasing limits in accordance with, ongoing processes for evaluation of plant counts, and given consideration of the approval of new qualifying or the recommendation for new qualifying conditions. So basically to say, no, we don't recommend it for completely doing away the limits, but we agree with some kind to increase the limits.
This is Jean Paul. I'd be in agreement with that.
This is Ariel. I'm comfortable with that. I think that understanding that it is like very much a responsive, ongoing process through the Department of Health makes sense. Is it appropriate to also recommend that is it appropriate to recommend that producers work on different strains and reducing cost to participants as well?
I think when we submit our recommendations to the secretary, I think that a lot of us have voiced that as a concern, and that can be included as part of the recommendations for the secretary, without necessarily be getting into the nitty-gritty of like specifying that as part of this particular petition. So I think it sounds like there is some agreement that we should consider the approval of this petition with modification to significantly increase the limits, with the understanding that there's going to be some ongoing regulation by the department to ensure the safety and safety of the medication that's also being produced. Is that a good synopsis and inclusion of the board's suggestion?
I think that sounds good. I agree with Ariel's suggestion as well, as of explicitly mentioning our intention of increasing the number of strains available to patient, especially high CBD strains, and decreasing the cost overall. I wonder if I think if this is even our place to say this, but I wonder if we're talking about increasing the number of plants available, the amount of medicine available to patients, allowing current growers to grow more is one mechanism for that. Another mechanism would be to allow licenses for more growers, and say that specific, we could say, and I don't know how the rest of the board feels about that, but my feeling would be that we recommend increasing the amount of medicine available to patients, be that by increasing the amount that growers can produce, but also looking at increasing the number of growers as a mechanism for meeting that goal.
This is Ariel. Jean-Paul, that's a really interesting idea. I know that in Oregon, they have, like the plant limit, but they have unlimited licenses for growers. And actually, this may be really impactful in terms of equity and in terms of, like people that maybe want to be licensed producers, but have more interest in different strains or in sort of like boutique areas of cannabis and medical cannabis specifically. And so I think that's like a good idea and interesting.
It might also be a way to, if we allow more growers, then we're going to get people applying for licenses in rural areas as well.
I agree with that. I think that the other part of this is that there are so many different barriers about the process for this, and all of it is going to be a delay with not only just the nature of growing the plants, getting the permits, all of that stuff. So I think if we agreed to adopt this petition to significantly increase the amount of limits at this time, then it would at least give the safeguards for the other approvals that we have already agreed on, so that we can continue to move forward and continue to work with the board and the petitioners on making sure that there is an adequate supply too. So it seems that we may be in agreement to move forward with a vote on this. In terms of like the specific, again, just for clarity of rules, just with the specifics of doing any kind of modification, it should, because the petition itself says it's an either or option. So we either limit or get rid of the limits, or we substantially increase the plant count. I think then with the modification could be to specify that as part of significantly increasing the plant count in order for that to meet the upcoming demands for the adequate supply. How does that sound before I make a motion to do a vote on that for the board members?
That sounds good. This is Davin.
I'm also laughing because I saw Ellen's thumb. So that's excellent. All right, so I move that we make an adoption to this petition to significantly increase the plant limits for this petition 2020-001 MCAB petition in connection with the determination of an adequate supply. Is there a second?
Davin Quinn, second.
Thank you, Davin. Let's do a roll call vote. Ariel.
Aye.
Kenneth.
Aye.
Jean-Paul.
Aye.
Courtney.
Aye.
Alan. Thumbs up. Vote entered aye. Davin.
Aye.
Stephanie, aye. Tracy.
Aye.
Excellent. All right, we have approved the petitions. We don't have anything else that had been tabled. And this, oh, sorry, I guess I was just getting some feedback. At this time, the next item on the agenda is for public comment. Public comment will be available for pre-registrants to comment first, and I would ask that they limit their speaking time to 3 minutes. If you have not registered, please click on the raise hand icon if you are using a computer, or dial #3 if you are calling by phone. For those of you unable to make a public comment during the meeting, the public comment period will be open for 48 hours after the meeting. Please send all public comments to the following web address: medical.cannabis@state.nm.us. I would ask for some assistance from the department in regards to calling on the participants, and in addition to notifying the public comment participants about their time allotted for their 3 minutes. So thank you for your assistance with that.
You are welcome. We are going to start with Duke Rodriguez. Duke, I am unmuting you. You are unmuted and you have 3 minutes. Your time starts now.
Well, thank you, first of all, for the chance to make a few public comments. And I do want to appreciate the board for taking the time of considering and significantly increasing plant count. But I think there'll be some discovery required to get it done right. But I wanted to share some comments with you and set the record straight. I want to read a quote to you from Judge Thompson's ruling in 2018. Quote, DOH has a duty obligation to ensure that patients can obtain an adequate supply of medical cannabis, and therefore DOH has a duty to adequately study and evaluate whether patients can obtain such an adequate supply. Now here comes the key part, because you've asked the question over and over, why hasn't it gotten right? And what about Dr. Zerlo's comment? Here's the problem. Quote, the plaintiff's claim is substantiated that DOH is not fulfilling its obligation to keep, because its data collection is unreliable and because its evaluation of supply is baseless and unreliable. To do this, they must make sure its decisions is neither arbitrary or capricious. Further, they may not rely on their regulatory authority. They may not rely on the regulatory authority as a pretext for justifying limiting adequate supply. That is, DOH may not use a statutory grant of the power to regulate to impede the fundamental duty under the Act, which is to ensure an adequate supply. The bottom line, after a lot of comments and testimony and expert witnesses, the court said, DOH, you're wrong. Your data is bad, it's baseless, it's unreliable, and threw it out. And it basically said it's completely wrong. The department continues to assert numbers that are not factual. They just recently said today that we have 5 million grams in supply. If you take that 5 million grams divided by 101,000 cardholders, that leaves a supply of less than 2 weeks. The statute says there must be a 90-day uninterrupted supply. Then they tell you we've raised the number of plants substantially. Keep in mind, when the lawsuit was ruled upon, there was 1/2 of 1 plant by patient. But the trajectory of the number of patients have increased faster than the plant production. Today, even today, on 2020 of November, December, there is less than 1/2 of 1 plant per patient. You ask the question, why hasn't cost gone down? You ask the question, why haven't strains been increased? It is solely and simply one answer. It's the
You have 30 seconds left.
Thank you, ma'am. It's the simple fact that there is not enough strains for discovery, for diversity. There's not enough strains to impact the market. The sole reason that the price has not fallen is exactly the comments that Dr. Zerlo was pointing to. There is sales outstripping production, and not until there's enough plants in production will there be enough diversity and lowering of prices. It's clear and simple. Economics have proven it, and the court has ruled the Department of Health.
Your time is up. Please finish your statement.
The bottom line is the Department of Health has repeatedly failed, but I do want to thank you for taking the time and recognizing we need a substantial increase in plant count. Thank you.
Thank you. Okay, our next person who will speak is Ginger Grider, excuse me. Ginger, you are unmuted and your 3 minutes begins now.
Yes, good morning. Good afternoon, I guess I'd like to say. I'd like to thank the Medical Advisory Board for meeting and taking time out of their day to come together and help us in New Mexico with as far as the patients go. I am the president of the New Mexico Medical Patients Advocacy Alliance, and I just wanted to express my thanks to the secretary and all of the staff, and again, the medical board for meeting. I appreciate you taking all of these petitions under advisement and hearing them, and especially I appreciate your expert advice The patients look to you and have always looked to you, and you all have always done such a wonderful job, especially in this year coming together and facing the challenges that we have faced. And I believe that we're going into the new year with a new secretary and that things are looking very good. I look forward to session and anything that we can do in the patient community to help out the advisory board, the Department of Health, or the producers. We are always more than willing to help out. And I just thank you all.
Great. Thank you, Ginger.
Yes, ma'am.
Okay, and that concludes those who have signed up. If anyone in our attendee group would like to speak, please hit the raise your hand button. And again, if you are on a phone, you can dial #3 and I can unmute you from there. Tiffany, I noticed you have clapping hands. I'm not sure if you meant clapping or mute or raise hands, so I just wanted to double check with you before I close the public comment period.
Hi, can you hear me?
Yes.
So I was just clapping for the comment that indicated increasing, not the increasing in plants, but having more growers. So I would like to, I guess, elaborate on that. I think that we should really look into the, do need more growers.
I think we lost you, Tiffany. Kind of broken up a little bit. All right, I'm going to mute you, Tiffany. If you have any further comments, you can certainly submit those in writing to the email that Ms. Richmond advised earlier. Okay, I have a call-in user number 5, and it looks like you are the only call-in user. So if you are on your phone, you are unmuted. Please state your name, and your 3 minutes begins now.
Hi, my name is Kylie Safa. I just wanted to comment on the reciprocity rule that is proposed, the rule change that's proposed by the Department of Health that the Medical Cannabis Advisory Board voted on today. I understand that there was a modification made to the rule regarding a 6-month period, and I wanted to raise a logistical concern of how that 6 months is tracked. Is it a consecutive 6 months? Generally, people will leave the state, come back to the state. They aren't necessarily here for consecutive 6 months. So I'm just not entirely sure how the department or the licensed cannabis producers are supposed to carry out that recommendation if it is accepted. And I wanted to agree wholeheartedly with the board members who stated that the reciprocity purchase limit should be equal to those of qualified patients. We shouldn't assume that a qualified patient has any more or less needs than a reciprocal participant. I think it's pretty safe to assume that a medical need is a medical need and that each should be treated equally. That along with one other thing I wanted to mention regarding the proposed rule is the proof of authorization. The statute is very clear in requiring simply that, quote, a proof of authorization. It doesn't require a card. It doesn't require that licensed producers or the Department of Health verify the standing of the practitioner. These are all additional requirements that the department have added to this process. And while I agree that patients need contact with their practitioners, I don't think it's fair to assume that they are not still receiving care from their practitioner, even if they have a proof of authorization from another source. And with that, I just wanted to again thank the advisory board for your time today and for your input on these matters.
Thank you, Kylie. Okay, our next speaker will be Ben Lewinger, and I will unmute you, Ben. Please state your name and who you work with, and you will have 3 minutes. Go ahead and speak.
Hi, Ben Lewinger. I'm the Executive Director of the New Mexico Cannabis Chamber of Commerce. We're a statewide member organization. Our members include licensed nonprofit producers, licensed manufacturers, and a growing number of cannabis adjacent businesses. And I just wanted to extend a thank you to Dr. Zerlo and the DOH staff and to the members of the Medical Cannabis Advisory Panel. It was a good discussion today. I know that lots of the questions or discussion points centered around the cost of medicine to patients. And I would just invite advisory panel members to talk with the industry and get a better understanding of why the prices are high compared to other states, most notably Colorado. Some of the reasons include the license fee structure, some of the challenges federally with 280E and some other items that we expect to change with a different administration in the White House. But kind of similar to Tiffany's comments, just thanks to the medical advisory panel, and the industry is here to answer any questions or be of support to the efforts. Thanks again.
Thank you, Ben. Are there any other individuals who would like to speak? Please raise your hand. Let's try Tiffany again. I see her hand is raised, so hopefully we can get her 3 minutes.
Awesome. Can you hear me?
We can now, Tiffany.
Thank you
Go
so
ahead.
much. My internet went out just at that point in time. So
Okay, would you mind just stating your full name and if you're affiliated with anyone?
My name is Tiffany Witkowski. I am part of the New Mexico Cannabis Collective Group. We have a group of people that, of advocates that help patients with whatever questions or anything they need. I also am a part of Dank Magazine. I do all the data analysis for them. So I had done one landscape analysis on our current programs, product, numbers for the total yield and the total sold. And the numbers came back saying that, to me, that we do need more growers. We need more growers in more areas. And I think micro businesses would be the right solution to increase the more, strains available to patients, and to also decrease the amount that we pay for it. I think that the plant count, that they should be plants in flowering, and nothing else should really matter. And that would also help with our decreasing the price and ensuring that we have available strains for everyone. And that's pretty much all I wanted to comment on, is that I do think we need more growers, and they should be micro businesses so that people in New Mexico can have a chance to be able to get in the industry. For our personal production licenses, I think people who are growing their own plants should get 2 more. And again, across the board, plant count should be in flowering. Flowering plants and nothing else should really matter. because you don't know what gender they are. You don't know if they're going to come out males or females. You don't know if they're going to survive into flowers. So flowering plants should be the plant count. I also think that we do need some additional funding for our vets and also for our terminally ill patients and our poverty patients.
You have 30 seconds left.
Thank you. And those guidelines should follow our SNAP guidelines that we use for our state so that people who don't have enough money can be able to afford. And I thank you so much for your time and everybody on the board for discussing and giving us a chance to make a comment. It's my first time commenting, so I was really nervous, but I appreciate all your time and everything that everybody has done for this department and for our program. Thank you.
Thank you, Tiffany. Okay, our next speaker is Scott Ransom. Scott, I will unmute you. You are unmuted and your 3 minutes begins now. Please state your name and if you are affiliated with anyone.
Hello, my name is Scott Ransom and I'm just affiliated. I'm just a veteran fighting for what's right. I'd like to ask you where we're at with creating a new emergency license for the terminally ill, the financially burdened population that can't afford medication, and for the veterans who are at the highest risk for committing suicide. I'd like to petition to open up licenses immediately to resolve this lack of access issue. We can no longer allow the current LNPPs to handle the needs of these populations due to their lack of doing so since the beginning of our program. I say again, this is an emergency situation and it needs to be treated as such. I was told to get my paperwork ready for application for a license, which doesn't even exist as of right now. This is unacceptable. I'm desperately asking for the patients that don't have the strength or the ability to fight. Please help me in my mission to provide no-cost medication to those in need. In reference to the unlimited plant count being discussed, I'd like to warn the board that the monopolistic system is broken and now licensed LNPPs are not taking care of the populations that need the most help. Why give them more plants so they continue to grow mid-grade commercial crops and charge whatever they can to make as much profit as they possibly can get away with, all while the people who live on their Social Security disability income give them the last $50 that they have. This is not the nonprofit system that was established. It has now become a for-profit business, and that's okay. It's sad, but it's okay. However, we do need to create an additional department that will truly be nonprofit system that is helping people receive no-cost medication. Thank you guys for your time. I really appreciate it. God bless you and God bless America.
Thank you, Scott. Are there any other individuals who would like to speak? Madam Chair, it looks like that is it for the comments.
Excellent. Thank you very much. I appreciate the public comments as this is something that affects all of us. Thank you for all of the comments, and I appreciate all of the board members' time in participating today in the meeting. And I do feel that what we have discussed today is pressing, and plan on sharing our recommendations with the Secretary of Health and have the information from our 2 meetings that we have conducted at her desk for her review as soon as I can, definitely before the end of the year and before the legislative session. So I appreciate all of your input and time, and it is approximately 11:52, and this meeting is now adjourned. For those of you that were unable to make the public comment during the meeting, just please be reminded that you do have 48 hours to do so at the web address of medical.cannabis@state.nm.us. Thank you for your time, and In terms of announcement for the next meeting, that is to be determined at this time, and I can imagine that it will be something that may be occurring after this upcoming legislative session. So keep your eye out on the New Mexico Medical Cannabis page for the announcement of our next meeting. Thank you very much, and I wish you well.
Thanks, Stephanie. Great job.
Yeah, thank you, Stephanie.
Thank you all, board members. Have a good day.
Thank you all for participating. We really appreciate it. Thank you, Stephanie, and thank you to all the board members and all the patients who and community members who have been here throughout this meeting. Thank you all.